Okay, welcome back everyone. Dr. Linda here. In this short video, we are going to look at connective tissue. We've covered epithelium, and remember what we said about epithelium is when we have a bunch of cells that are closely packed together with very little extracellular matrix. And in contrast, when we look at connective tissue, this consists of cells that are widely spaced apart, and it has lots of extracellular matrix. We abbreviate that as ECM, extracellular matrix. Okay, that's the substance that we find between the cells. And connective tissue is the most abundant and the variable type of tissue that we find in the body. And it connects other organs to each other. It even connects to the epithelium. It will connect to the epithelium. It gives support and protection, physical protection and immune protection. Well, physical protection, how about your bones? That's physical protection, right? You have the brain that's protected by the skull. You have the spinal cord protected by the vertebrae. Bones are a type of connective tissue. Well, what do we mean by immune? Well, how about white blood cells, WBCs, white blood cells, especially B cells, and B cells can become plasma cells, and plasma cells create antibodies like IgE antibodies or IgM antibodies or IgG antibodies. These help protect us. Okay, we know if someone is recently exposed to COVID, we could check them for antibodies. If they're recently exposed, we'll see something called IgM that's high. But if they've been exposed in the past, maybe 4 months ago, 5 months ago, we'll see a different antibody that's high, and we'll call them IgGs. But these are antibodies. Connective tissue, also storage of energy and heat production because of fat cells. Adipose or adipocytes, those are fat cells. And but by the way, just like a good clinical gem for you, these antibodies, I see a lot in my office people with allergies, food allergies especially, kids with ADD, ADHD, people with skin rashes, migraine headaches, people that just can't lose weight, itchy skin, itchy scalp, right? They don't know what's going on. So we check them for food allergies. And similar concept, we could check for immediate type of response, and those are called IgEs. If someone has high IgEs, that means that maybe they ate something today, and that's what they're allergic to. If it's eggs, they're going to have high IgE to eggs. If it's dairy, high IgE to dairy. But we could check antibodies from something they may have been exposed to 20 days ago. Maybe it's not something they ate today or yesterday, but maybe 2 or 3 weeks ago. Those are called IgGs once again. It's a delayed response. So we can use these to figure out a timeline as well. Is it recent or old? Also, movement or transport of blood. The movement and transport of materials because of blood. So we can move oxygen through the body. We can move nutrients and waste products. It's moving it all through the blood. And blood is connective tissue. It's just liquid connective tissue. Fat or fat cells are connective tissue. And we all need fat cells, and it's just you want them managed. So body composition is really important to maintain until about the time of puberty. If you are good body composition at time of puberty, there's less chance of being obese when you're older. Not that it can't happen, it's just less chance. If you're thicker at time of puberty, it's more challenging for people that are thicker at the time of puberty to manage their fat cells. Much more difficult because those fat cells that you have can increase in size and they can decrease in size as well. So what are some of the characteristics of connective tissue? Most connective tissue is highly vascular, meaning they have a good blood supply. There's a few exceptions to that. Cartilage, tendons, and ligaments, they don't have the best blood supply. They're poorly vascular. And in terms of what has the of these three, which has the best blood supply and the worst, I would say like this: your tendons, which are an extension of muscles, are going to have the best blood supply of these three, and then ligaments will probably come in second place, and then cartilage I'd put in last place. So cartilage is going to have really, really, really bad blood supply. Think of the knee. Think of the meniscus. If someone tears the medial meniscus or lateral meniscus, it's going to take a really, really long time for that to heal. Someone has a muscle strain or they tear a tendon, it'll heal, maybe take a little bit longer than other tissues, but it'll heal faster than cartilage. Ligaments go bone to bone. They take think of like an ankle sprain when you tear some ligaments of your ankle. That could take a few weeks to heal up. Muscle strain, when you're involved, tendons, that could take 3, 4, 5 days to heal up. So connective tissue as a whole, pretty good blood supply, with the exception of these three: cartilage, tendon, and ligaments. Remember, connective tissue is made up of different types of cells, and it has lots of non-cellular, non-living material called ECM, the extracellular matrix. ECM, the extracellular matrix, it's what is degraded and broken down in chronic inflammation. Great little clinical gem. Patient comes in, they have shoulder pain, and I go, your OPQRST for onset, what provokes it, makes it better. Quality of pain, does it radiate? Show me the exact site and the severity and the timing of it. So when they say the onset and they start looking up in the air and they're thinking and they're going, what year is it? You know you're in trouble. That means they've had it for years. The fact that they have it for years is chronic. Chronic inflammation is degrading the extracellular matrix. That means what may have started as a shoulder sprain or an ankle sprain that went chronic, now it's going to break down muscle, tendon, ligaments, cartilage, joints. Really bad when something is chronic. Chronic inflammation is really bad. Acute inflammation, short-term inflammation, is really good because inflammation is the initial step of healing. When something is healing, it's inflamed, it's red, it's hot, it's swollen. Those are all good things. It means your body is trying to fix itself. All right, when we look at connective tissue, I want you to see that we have 1, 2, really 3 main categories of connective tissue. When we look at fluid connective tissue, we're going to be looking at primarily blood. And when we think of blood, we know we have red blood cells and we have white blood cells. And there's different categories of white blood cells. White blood cells have granular sites and agranular sites. You'll learn more about that in anatomy and physiology too when you get into the cardiovascular system, okay? When we look at supporting connective tissue, hey, what supports the body? Well, the bones support us and cartilage supports us. When we talk about bone, which has a solid matrix, when we look at blood, blood has like a liquid matrix. The matrix of blood is called plasma. That's the matrix of blood. The bone matrix is pretty solid, right? Calcium salts. We're going to talk about compact bone primarily. I'll show you what spongy bone is, but under a microscope, there's lots to look at with compact bone. And when we talk about compact bone, you're going to hear the term osteon, right? Osteo means bone, osteology. So the osteon is associated with compact bone. Cartilage, we have three flavors of cartilage. We have hyaline cartilage, elastic cartilage, and fibrocartilage. So supporting cartilage and fluid connective tissue, those are two types. And the first type here is connective tissue proper. And under connective tissue proper, we have loose connective tissue and dense connective tissue. Under dense is regular and irregular and elastic, and under loose, areolar, adipose, and reticular, right? That's why I said muscle and nerve is the easiest type of tissues to learn. Epithelium and connective is more challenging. Epithelium is easy to categorize it. When we look at connective, you've got a lot of moving parts, but referring back to this slide will be important, okay? So we're going to look at this, and now we're just going to move into connective tissue proper, then supporting, and then blood. So let's look at connective tissue proper. We said connective tissue proper is loose and dense, so we have loose and dense, okay? Then we go into the fluid, which is primarily blood. Then we'll get into supporting connective tissue, which is cartilage and bone. Okay? All right, so let's go back here and let's look at loose connective tissue. Loose connective tissue proper. The biggies here are going to be areolar and adipose. Not that reticular is not important. It is. It provides the framework. That's reticular. Adipose, these are fat cells. Now, under a microscope, they look a lot like squamous cells, right? Here's a squamous cell. Nucleus is in the center. Here's a fat cell. Nucleus is at the periphery, right? So that's the main difference. In adipose, you're going to have a nucleus that's off the side of the cell. Okay, so this one that I crossed out, that's a squamous cell. Areolar, really important. This is where a lot of injectables are given. It is the space between your skin and the muscle. And within that gap between the two, we have a lot of blood vessels and capillaries that line there. So it's the padding that separates the skin from the deeper tissues like the muscle. Like if you pinch your forearm, you can't really pinch your muscle. It's gapping and separating away. It has a lot of elastic fibers and collagen fibers that are there. That's areolar. When we look at dense connective tissue proper, we have dense regular and dense irregular. The difference between the two is, are these collagen fibers kind of parallel to each other and tightly bound to each other? When you have collagen fibers that are densely packed, like we'll see in tendons and ligaments in this particular instant, that's going to be dense regular. Collagen is a protein fiber. We find it in hair, skin, nails, blood vessels, tendons, bones. It's just about everywhere. It's a main protein. In fact, collagen fibers are going to make up 1/3 of bone, just to give you an idea. Dense irregular connective tissue, we're going to find that in the skin, in the dermis. And you're going to have collagen fibers here as well, except the collagen fibers are not running in all the same direction. And that's important because if you look at the top layer where the collagen is parallel to each other, if this was the skin and you start massaging and doing friction against it, you could damage it. When you have collagen fibers running in all different directions, that's why it's called irregular, you can manipulate the skin and twist it in so many different directions. it's not going to rip and tear the skin, unless, of course, you have an autoimmune connective tissue syndrome, and there are several. Elastic connective tissue, these are found in certain ligaments, especially of the vertebral column. Remember, ligaments go bone to bone, and they keep them in alignment to one another. The vertebral column is pretty stable. I have never seen a patient come in with a dislocated vertebra, and I've seen a lot of spines. I think I've calculated over 300,000 spines in my career so far. Now, the vertebral column, those vertebrae can misalign, but they're not going to dislocate. Okay, so it is important for the vertebral column to have ligaments that attach to it, but the ligaments need to be elastic to allow for the flexibility of the spine. It's going to have some collagen as well, but not as much collagen as it does elastic connective tissue. Okay, other parts of the body, like the knee, that is very unstable and very flexible, the ligaments of the knee are going to have much more collagen for strength and stability than elastic connective tissue. Okay. Okay, let's look at blood. Is fluid connective tissue, not just blood, but lymph. Okay, what is lymph? The interstitial fluid that's found between the cells of the human body, right? That extracellular fluid is interstitial fluid. It's going to enter your lymph vessels. Okay, blood, these are your erythrocytes, your leukocytes, and your thrombocytes, which are platelets. Erythrocytes are your red blood cells. Leuko means white, for white blood cells. Platelets, these form a thrombosis. So those cells used to be called thrombocytes, but now we refer to them as platelets. They involved in clotting to help you stop bleeding. Okay. Now, cartilage, avascular, right? We said it's got poor blood supply, very avascular. Cartilage cells are called chondrocytes. The three different types of cartilage are going to be hyaline, elastic, and fibrocartilage. Hyaline cartilage, we're going to find at the ends of your bones. They cover the ends of the bones where we have joints that are formed, especially the freely movable joints. At the very end of those bones are going to be hyaline cartilage. When hyaline cartilage wears away and degenerates, we call that degenerative joint disease or osteoarthritis. Not the same as rheumatoid arthritis. Okay. Elastic cartilage, we're going to find this in parts of the body that require flexibility. We'll see elastic cartilage in the ear, around the lungs, the epiglottis, in the throat. That's elastic cartilage. The eustachian tube, that's elastic cartilage. Fibrocartilage, this is the strongest cartilage in the body. Your intervertebral discs. The discs between each vertebral segment, we call them IVDs, intervertebral discs, herniated discs, bulging discs, right? You heard the terms. That's fibrocartilage. It's the strongest cartilage in the body. We'll also see it associated with the knee joint. The meniscus is fibrocartilage, and the pubic symphysis is also fibrocartilage. So I've seen this pop up on a matching section. What's interesting about fibrocartilage is that fibrocartilage is made up of collagen but type 1 fibers, whereas hyaline is made up of type 2 collagen fibers. There's different types, 1 and 2. Many times I give my patients that have different types of degenerative joint disease or osteoarthritis, I'll give them supplements that have type 2 collagen fibers. if we're working on degeneration of, let's say, the hip joint. But if we have intervertebral disc herniations and I need to support the nutrition there, we use type 1 collagen fibers. Okay. The elastic cartilage, that's composed of a network of branching elastic fibers. So how do you remember the difference between type 1 and type 2? A, B, C, D, E, F, G, H. F comes before H. Type 1 1 occurs before 2. Okay? All right. I've seen this pop up before too under a microscope. These things here, these are actually the cartilage cells. Okay, those are actually the cartilage cells that are referred to as chondrocytes, but that's not what they're asking here. They want to know what the highlighted structure is. The highlighted is everything that's that aqua blue. So whenever we're talking about something that's between the cells, remember what that is? That's the matrix, the extracellular matrix of hyaline cartilage. Okay. All right, let's look at bone. When we talk about bone, again, we're still under connective tissue. This is supporting connective tissue. We're going to hear of different types of bone cells. One is called the osteoblast. 2 is called the osteoclast. And then 3 is called the osteocyte. The osteoblast with a B builds bone, forms bone. The osteoclast with a C for see you later breaks it down. So these osteoblasts and osteoclasts, these two, one is building the bone, that's the osteoblast, and then one is breaking it down, osteoclast. And we need this to happen. We need bones to build up and break down, right? That's just normal metabolism. Things build up and break down. Skin builds up and breaks down. Red blood cells build up and then they break down. This happens in all tissues of the body, not just bone. Okay. So osteoblast with a B is going to build bone by forming matrix. So it's going to push out these calcium salts. It's going to push out cement. Well, we know what happens to cement. Cement dries and it hardens. And when it does, that osteoblast evolves into an osteocyte. Okay, but the osteoblast is kind of trapped in the matrix that it produced, right? So I'm an osteoblast, I'm this cell right here, and I'm pushing out this matrix. I'm pushing out all of this extracellular matrix and all these calcium salts all around me, and eventually all of it's going to calcify. And then this cell that's an osteoblast can't move, it can't get out, it's stuck. So now it's stuck in this little cavity here. And now it can't move, it can't get away, it's called an osteocyte. Okay? The place that the osteoblast is stuck in, it's actually stuck in something called a lacunae. That's the cavity that contains the osteocyte. Okay? Okay, and an osteocyte is a mature cell. Okay, the osteoblast is an immature cell. Immature cells can produce matrix, mature cells cannot. Again, osteoblast build up bone, osteoclast break it down. When you are breaking down bone using these osteoclasts at a faster rate than osteoblasts can build up bone, we call that osteoporosis, or in the beginning stage is osteopenia. Okay. Concentric lamellae. I'll show you what that looks like. If you can envision what chopping a tree, when someone chops down a tree and you look at the concentric rings, that's called concentric lamellae. That's what bone looks like. It's pretty amazing. It looks like a tree that was chopped down. Right? And right in the center of it is something called a central canal where there's arteries and veins. Okay, lacunae, the periosteum. Periosteum is the outer layer of bone. The endosteum is the inner layer of bone. The periosteum is where your tendons attach and ligaments attach. The endosteum is where we're going to have spongy bone. Okay, when we look at it, here's the long bone right here on the top left, and this portion here is spongy bone. This portion here is spongy bone. This portion along the outside, all of this is compact bone, right? So here's compact bone. All of this stuff from here to here, this is compact. Everything on this side from here to here is compact. This part inside in that medullary cavity, which is here, the inside, that's spongy bone. That's where it looks, they call it trabecula. Okay. Each of these, this whole section right here, this would be one osteon. Okay, here's another osteon. This entire group looks like a tree cut down is an osteon. This is another osteon. This is another osteon. And what they're made up of are these concentric rings. And way in the center of it is that Haversian canal, or the central canal, Haversian canal or central canal, where you have arteries, veins, nerves, and lymphatic vessels. Okay, bones are vascular. That's right. I mean, you're going to have blood vessels feeding bone because you got to bring calcium to the bone, and sometimes you got to remove calcium from the bone. The outer part of the bone is called the periosteum. Down on the bottom, you see periosteum. And on the inside of the bone is the endosteum. So those are some key words when we talk about bone. So here, when we look at this entire structure, let's look at it. Is it a lacunae? No, the lacunae is this black hollowed out section right there, and this one here. And these are lacunae, which is where the osteoblast got trapped in. It actually houses the osteocyte. Central canal? No, the central canal is right here in the center. Arteries, veins, nerves, lymph, all in there. Canaliculi. Canaliculi are going to be what we see, these spider-like webs, these spider-like legs that come off of the osteocyte. Those are the canaliculi. Okay, so what we're looking at, this entire structure here is going to be an osteon. Okay, an osteon. That whole thing is an osteon. If it wanted to know lamellae, then it would highlight, let's say, one of these layers going around would be a concentric lamellae. But the whole thing is actually highlighted there. That's the osteon. Okay, now let's take a look here. Could the highlighted structure be an osteon? No. Could it be a central canal? No. Could it be the lamellae? No. Could it be the canaliculi? No. Watch, here is an osteocyte, and it's trapped in this lacunae. Okay? And then the extensions coming off of that osteocyte are called canaliculi. So the highlighted structure is the actual cavity. That's the lacunae that houses the osteocyte, which at one point in time was an osteoblast. Good place to take a break. When we come back, we'll talk about muscle, which is a pretty short